You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, we're covering two topics today. Same-day dentistry, this new trend in dentistry, which is certain dentists are handling everything under one roof and doing just about everything in the same day. On the second part of the show, we're going to talk to denture wearers about denture stabilization, locking in your dentures so you can eat whatever you want, supported by dental implants. With us, we have San Antonio's go-to same-day dentist, Dr. Reyes. Dr. Reyes, welcome to the program.
Thank you, Randy. It's a pleasure.
Now, before we get into today's topic, and I know you brought a lot of photos, so we'll go over those. Yes. But for people that don't know your practice, who's the typical patient? Like, what are the different services you offer?
Well, Randy, I have a general dental practice, and we do pretty much everything from root canals, and which is great because there's no need for you to go to an endodontist, which is a little bit more expensive than what we do in our office. We do braces. Again, it's a specialty, but we do it in our office. We do Invisalign as well.
So adult orthodontics too, or kids?
No, of course we do adult orthodontics as well, because as we age, we start showing maybe more of the lower teeth, and people start to notice that. We also do wisdom teeth extractions, which eliminates the need for you to visit an oral surgeon, which is oftentimes a little bit more expensive. And we do our own sedation. We do IV sedation as well.
Do people do a lot of that sedation?
Not really. I mean, only general dentists across the nation, probably about 5% of dentists do IV sedation. And we actually have a special room in my practice specifically for that.
Are there a lot of people, as far as patients, wanting to be sedated while they get things done? Of
course they do. I mean, there's the people that have not been to the dentist in many years because of the fear of the dentist, and they can get a lot of dentistry done in a matter of in a single visit. And there are those that require sedation for surgical procedures such as wisdom teeth extractions.
Okay, and now you're big on dental implants, like stabilizing dentures. Tell me about that.
Yes, actually, there's a lot of denture wearers in San Antonio, and the number one problem with denture, specifically a lower denture, is that it's always ill-fitting. People are always afraid that it's going to come loose, or they're gooping a lot of glue on it. I think the standard of care should be dental implants, at least 2. I usually like to put 4 implants because it provides a lot more stability.
So 4 implants, they get a full arch of teeth that just lock in there?
Absolutely, and it allows the patient, it gives the patient immediate confidence in being able to chew what they want and smile without the fear of this denture falling out of their mouth. So Randy, another thing that we have in our practice is we use a soft tissue laser. And the soft tissue laser is excellent because it allows us to contour gums. Like you've seen people with gummy smiles.
Yeah.
And when diagnosed properly, all it takes is for us to even sometimes just applying topical anesthetic and contouring the gums and make their teeth look nicer and longer, more natural, and eliminate the gummy smile.
Okay, now these crowns in a day, I mean, I guess you have like a lab right there that makes crowns?
Absolutely, yes. We have we use technology that it's called CEREC.
Okay.
Now, CEREC is exciting because it allows us to make and deliver an exceptionally quality crown all in one day while the patient waits. The way this procedure is normally done, the crowns, is that you go to a dentist and they'll do it in 2 procedures, actually in 2 visits. The first visit is where you would go in, the dentist will prepare the tooth to receive the crown. Then you would get this gooey material that they have to make an impression with, send that to the laboratory. When you get that back, it usually typically takes about 1.5 to 2 weeks. In the meantime, you have to have something on the tooth, and that's usually in the form of a temporary crown, which is made of plastic. A dental assistant will make this crown, and God forbid that this crown breaks or comes off between appointments, because now the patient has to find time to come back to your office, to take care of that. And the other thing is, once you get your crown in from the lab, you hope that it fits, because if it doesn't, you have to repeat the whole process again. And CEREC eliminates this whole mess.
So your machine that makes these crowns.
Yes, CEREC.
How does that work? How's it different?
CEREC is amazing. What it does is it uses CAD/CAM technology to scan a tooth.
Like with a wand in their mouth, or how do you do it?
Absolutely, it's sort of an intraoral camera, and while the patient is waiting, we have essentially it's a 3D printer. While the patient is waiting, this machine prints out their crown. And what I do often is I invite the patient to come over to the machine, and and the first thing they do is nowadays everybody wants to videotape everything.
Oh, that's
so they'll
right.
grab their phone and start videotaping the process, and what they share it with their friends and family, even post it on social media. I mean, this speaks volumes to the immediate confidence that CEREC provides.
Now, anticipating you're coming here, talking to some people, and talking about the same day approach, but nobody likes going to the dentist. Do you still hear that? Like, hey, no offense, doctor, but...
I hear that all the time, but because we treat them so well and we offer sedation, I mean, even the laughing gas, it changes their whole perspective about dentistry, and you treat somebody right, and they'll keep coming back to you.
You say that in one day, their lives are changed.
Oh, absolutely,
sometimes.
Randy. And let me tell you something. I have an example here of one gentleman that he's a great guy, when we saw him at first, this was his, smile. We asked him to smile, and this is the way he was. This was his smile. He was a great guy, great personality, awesome guy, but he would not smile. And then once we kind of looked inside his mouth, we found out why, and this is where we can help these people. And it's not his fault. I mean, this is a bacterial infection that he has been dealing with for many years.
So he didn't walk in with bridges or anything?
Nothing, Randy. This is the way he walked in, yes.
But this has got to be unusual to see something like this.
It is not, Randy. I mean, you don't see them because these people don't smile. I mean, he doesn't even, he said he was probably the worst case that I had seen. And I reassured him that this is what we do every day.
Okay, so what did you do for him?
He actually had several options. He had the option of doing an aesthetic denture or a denture that would snap onto implants. He chose to start off with just an aesthetic denture.
So like a cosmetic denture.
Oh yes, that's exactly what we did for him. And when you look at people like this, you may not know it, but these people get discriminated against, and sometimes they get judged as well. And it's not their fault.
Like they're poor, just because they have bad teeth.
Yeah, and that's not the case. This is a very nice gentleman. And, we cleaned him up, we removed these teeth, and just by removing the teeth alone, his gums get healthy immediately because you're getting rid of a bacterial infection.
Okay.
So let me show you what we did for him.
Okay.
We made him an aesthetic denture, and it's actually more like a cosmetic denture. And, at first, you look at him, it's an awkward smile because he's not used to smiling. He's spent many, many years without smiling. And, you can immediately see the confidence in him. Now look at this one, Randy. I mean, look at the way he smiles. He just lights up. He is a totally different person. And it shows his real personality. Now, people like this, when you first show them that new smile, I mean, they get emotional. I mean, their family members
like in the mirror in the office.
Absolutely. We give them a mirror and they look and they just can't believe it. Usually we have family members in there and people get choked up, even including my dental assistants often. So here's what I want to do next with him is that I want to at least put 2 to 4 implants on that bottom denture so that they can snap in, and so that it'd be like having another set of teeth, and so that he's confident enough to eat whatever he wants.
So they could eat like what?
They could eat corn on the cob. They can eat steak. They can eat crunch into an apple, things like that.
Is that the future of dentures? Because we've talked on the phone. And the problem with dentures is they're not attached to anything. Is the future of dentures maybe 20 years, 30 years, where nobody will have a regular denture, they'll all be attached to something, like the implants? Is that your thought?
I truly believe that the standard of care for lower dentures should be at least 2 dental implants. And that, provides that stability that is needed, especially on a lower denture.
And you do a lot of these, right? I mean,
yes, we do. We do this in our office routinely.
To lock them in with dental implants. How old can you be to do that?
Oh, I mean, I've done patients as young, patients in their 30s, and all the way to their 80s and 90s. There's no age for this. If you are a denture wearer and you're unhappy because you have to use glue or it's ill-fitting and you're not smiling like you should be, you really need dental implants. So what we did for him was that we placed 4 implants, and those 4 implants were able to lock in that lower denture, and it completely changed his life.
At 83 years old?
Absolutely, yes, sir. At 83 years old.
They're not more likely to implants fall out?
No, not at all, not at all. Implants are not going to, they're not going to fail because of your age.
Okay, now what about pain? Because it seems very painful.
The way we do this procedure nowadays and the technology we use is 3D technology. We treatment plan this so that we make it less invasive. And it's not really, we often do it just with local anesthetic. If the patient chooses, like I mentioned earlier, we also have the option of IV sedation. That way, you take a little nap, you go to sleep, you wake up, and you have your implants in that you can snap your dentures onto. So in regards to pain, Randy, everybody heals different. So, but most of my patients really report minimal pain, even with just using local anesthetic.
And what about the next day? Like, what do they take that night? You give them pain
they
meds?
Can just take I give them a prescription for ibuprofen, but usually they end up taking just over-the-counter medication such as Advil or Tylenol, and it usually is enough.
So when you lock in the full arch of teeth on the dental implants, how soon can they eat?
Oh, they can eat immediately. They can eat that day. In fact, I had a patient recently that was actually called my office to see if it was okay for him to eat a steak. And we told him absolutely, go right ahead.
So no more regular dentures.
No more regular dentures, no more glue.
No more glue. So is this whole same day dentistry approach where one dentist, I know it's not a real term, super specialist, but where one dentist does just about everything in the same day. Are there a lot of guys doing that where you are?
I really don't know if there's a lot of guys that do that, but we are doing that, and I really think that that's the future of dentistry. So
in your bio, we talk. I mean, you go to a lot of continuing education. Now, you were a dentist in the Air Force?
I
was.
That
right?
Yes, sir. Yes, I completed a advanced education in general dentistry while I was serving in the United States Air Force, and I truly believe that every graduating dentist should complete some sort of advanced training in order to better serve the public, because professional development in my office is extremely important in providing an all-encompassing experience for my patients.
Now, in the Air Force, do you learn more things because you're in the dentist? I mean, more like dental implants and oral surgery kind of thing?
Yes, they do have a residency program for general dentistry in which you have the specialists working right alongside you. I mean, teaching you what they do so that you can do it out in the field per se when you're active duty. But once you leave the military, you carry on those skills. You don't leave them, and so that you're able to treat your patients better.
And you speak Spanish in your practice?
Absolutely, yes. Spanish is predominantly spoken by almost all my staff speak Spanish. There's a lot of Hispanics in San Antonio, and we cater our services to everyone, obviously, but we do speak Spanish.
So more photos. We have time for a couple more photos.
Now, Randy, here's another example of what we can do with this snap-in dentures. Here's a gentleman, very young guy, who this was his smile, and he had actually the 3 teeth that you see there in the front is a partial that he had been wearing for a number of years. Once we looked in the mouth, this is what we saw.
Oh my goodness.
And I could see why he was in pain. He had infection and some abscesses and things like that, what we saw in his radiograph. And we were able to transition him from a,
what's going on there?
This is just things fell apart on him, and that's okay. I mean, this is somebody.
Is this also common?
This is, like the previous gentleman that we showed earlier. He, again, it's something that is common, but he doesn't think it's common, and he was ashamed,
Because they never smile.
They never smile. They never smile. So what his options were with him was a regular denture, the snap-in denture, and an implant support denture, and he was absolutely not going to wear a denture. So we went on with a snap-in denture with him, and it made a world of difference. If you can see here, and
oh my goodness.
I mean, what a difference. You can see him smiling now. Now, I want you to put them side by side and look at, his, the way he smiles on the after picture. I mean, you see somebody who is confident, somebody who may be trustworthy, friendly, somebody who's healthy. I mean, as opposed to the way he was, self-conscious of, what he had because he was ashamed of it.
I mean, it looks like porcelain veneers.
Well, this is a cosmetic denture.
And so those are just locked in.
Locked in.
Like a full arch of teeth, locked into dental implants. So he could eat whatever he wants?
He can eat whatever he wants. And in fact, that's what he's doing now.
And how long do the implants last?
Oh, no, his future is going to be completely different because these implants are going to last as long as you last.
Okay. And what is the maintenance on this? He just comes in, gets them clean?
He comes in, every 6 months, let's say, and we make sure that the implants are clean. Now they're really simple to clean, and it's a lot easier for him to clean as well.
So young and old, it doesn't matter?
It does not matter.
And what's the typical age of people getting dental implants?
Randy, we do implants on people in their 20s, all the way to people in their 80s and 90s. It does not matter how old you are to receive dental implants.
Now, in San Antonio, are there a lot of people wearing dentures that could benefit from a snap-in?
Absolutely.
It's a common thing?
You'd be surprised how many people are out there that are wearing and dealing with ill-fitting dentures, or using glue and still afraid to smile because of the lack of confidence that they may fly out of your mouth. Dental implants eliminate that problem.
Now, when this is done and you lock them in with dental implants, is this one of those things where they say, I should have done this years ago?
I hear that all the time. I mean, it's people always say, why didn't I do this years ago? They're missing out.
So they should do it.
Absolutely. I truly agree that this is the future of dentistry.
Now, at your office, free consultation?
Yes, yeah. That's all we ask is, we're not going to charge you anything for that first visit. It's just your time to come in so that we can, open up a world of option for you, which, what dental implants are nowadays. So let me show you this other photo. We also do a lot of orthodontics.
Okay.
And, kids are brutal. When you look at somebody like this, a beautiful little girl, very nice, but this is what, the way she looked. And we do conventional braces, and we also do Invisalign. We typically do it more for adults. Adults don't want to be wearing brackets and wires and things, and it's a thing for kids now. And this is the type of thing that we can convert kids, from here to here. Look at that beautiful smile. I mean, it's a world of difference.
It's nice. So this is orthodontics that you do in your practice. Where do you stack up against a regular orthodontist? Now, as far as price, I'm asking.
As far as price, because I'm a general dentist and I'm not a specialist, but I am trained in doing orthodontics, we are less expensive than a specialist.
Okay, and so you do it all right there.
We do it all right there. We try to be we know people hate going to multiple offices to get treatment done, and that is why we try our best to do to be a one-stop shop, if you will.
Let me back up, because something I think you were about to say earlier, and I asked you another question, but you said it's a great time to be a dentist right now. Why is that?
So Randy, it's a great time to be a dentist right now because of all the technology that is available to us that makes dentistry such a joy. Now, part of that technology is a piece of equipment called CEREC. So with this CEREC machine, what it allows us to do is that what used to take a couple of weeks to get a crown from a dental laboratory now takes us just a little over an hour, same day, same visit. And this, speaks volumes to the confidence that this CEREC machine offers to dentists nowadays. It's amazing. So also with CEREC, it allows us to deliver a crown when it's ready, let's say an implant crown, when it's ready to be restored, or actually when an implant is ready to receive the crown, we're able to do it with CEREC that same day, that same afternoon. It's very flexible. Let me tell you another thing is, if you are missing a single tooth and you opt not to have a dental implant placed, CEREC can make a bridge.
Okay.
Again, like replacing your missing tooth.
In the same day?
Same day, same appointment, while you wait.
Now, why, if you're only missing one tooth, would you want to get a dental implant over a bridge?
Now, bridges work really well. I mean, that's the way things were conventionally done. However, with a bridge, you have to carve down the adjacent teeth. So with a dental implant, you leave those adjacent teeth alone so that if there ever is a problem, you won't have a three-tooth problem. You only have your implant right in the middle. Another great thing about what's new is that with dental implants, you can use those and be able to eat that same day. And this process used to take 6 to 9 months, and that's not the case anymore.
So nowadays, if somebody's missing one tooth, if everything works out, they could get an implant, get a tooth on top, and they walk out that same day with a tooth.
So in certain cases, we're able to do that. You can come in, let's say you come in with a broken tooth, we're able to maybe remove the root, place an implant, and be able to place a tooth so that you are walking out of the office with a tooth. So let me show you another transformation that I have here. Here's a gentleman in which he presented to my office, and he was concerned about his smile. He had an ill-fitting crown. It was causing gum inflammation, and he had a composite or a tooth-colored filling that was discolored. What we did for him is we did some veneer work. And after a couple of years, sadly, he had an accident in which he ended up breaking his front teeth, and we were able to replace those teeth with implants, and he still has that beautiful smile.
Let's take a look.
So this guy, after his accident, in most cases would have ended up in some sort of partial denture or a denture, but we were able to place some implants and be able to give him his front teeth back. And I mean, look at the difference between when he presented and the end result.
So you don't really like dentures?
I really don't, Randy. People should really be, holding those dentures with dental implants, and that's really the future of dentistry. And as I briefly alluded earlier, it should really be the standard of care.
So if you have a denture, get them attached to dental implants.
If you wanted to continue to struggle with your denture and spending money on glue, then go ahead. But I think it's dental implants is definitely the answer.
Now we should mention, I guess, how dental implants are normally done. You go to one guy that does the surgery, another person puts a tooth on top. You do both parts.
Okay.
Is that right?
That is correct. That is correct. So what I do is I am the guy that places the dental implants, and I am also the person that restores or places the denture right over the implants. So every step of the way, I am the person that has this whole planned out. It's not so that there's no miscommunication between going to a surgeon to place the implants, going to a prosthodontist to place the teeth on. I am the one person that is doing both of these.
But you do, you are aligned, I guess we've talked, with oral surgeons and prosthodontists for certain cases.
Yes,
Is that
absolutely.
right?
We actually have privileges to work out of a dental implant center in San Antonio, in which we are able to provide the procedure called Teeth in a Day.
Okay, so you do it all right there.
All right there, all in one day. Let's say you let's say you decide to go with that option. We go to the implant center. If you have teeth, you show up in the morning with teeth. We sedate you, IV sedation. There's a surgeon, removes the teeth. We place the implants and we place your new teeth, and you walk out in the afternoon with teeth ready to use, ready to eat. That same day.
In the same day. Is that common? So people with broken down, really bad gums, can you do this with bad gums? Like really bad broken down teeth, they need to be extracted, and you could do that in the same day. Extractions, yes. And then they get their teeth.
Yes, absolutely. That is stuff that we do at the implant center on a daily basis. That is the only thing that we do at the implant center.
So what are the options for a denture wearer? I want to ask you that we have a few minutes left. So if a denture wearer goes into you, or somebody you can't save their teeth, what is that conversation like as far as options in your office? So
when it comes to dental implants, the options are minimal 2 implants, and that's great because it'll stabilize the denture, but then, you get that denture rocking sometimes. 4 implants is ideal. That way you don't get that. So with 4 implants, I give them a full arch of teeth that are ready to use and they're able to eat. Now, the next step is that if you want something fixed, that's when we go to the implant center, and you get implants that get locked in, and you get a whole set of teeth.
So they don't come in and out?
They don't come in and out. No, not at all. Now the upper, Randy, is upper dentures. You have that palate that is covered by plastic. So that
they don't like that.
They don't like that at all because you can't taste your food. It covers a lot of taste buds. You can't temperature. Sometimes you can't feel the cold drinks that you're having. So in order to eliminate that palate, again, we go with the implants. At minimal 4 implants up on top, and we're able to eliminate that palate. And again, the same process, you either get the ones that snap in, or we go to the implant center and you get your fixed teeth.
As a recap then, fixed teeth on the upper and lower supported by implants that don't come in and out, or a snap in, snap out. That's much more affordable?
Not only is it more affordable, but it allows them to eat what they want, and it gives them that confidence that these dentures, their teeth, are not gonna, again, pop out of their mouth.
Now you're a dentist, so it does not surprise me to hear that you think the smile is so important. How important is the smile in your opinion?
Randy, again, just because I'm a dentist, I obviously think that the smile is the most important thing. But the truth is that society sort of thinks the same way. And let me give you an example. If you read People magazine, Men's Health magazine, and they often run articles and surveys on appearance and what makes a person attractive. And the smile is always in the top 3.
That's
if
true?
not
Okay.
the number 1 thing that people think is important. So let's take, for instance, twin sisters, and they go in for a job interview. One smiles, one doesn't. You're obviously gonna, probably the one that smiles is gonna get hired just because she's gonna look more dynamic, more confident, more trustworthy, and healthy.
So smile makes a big, and that's a good point. It's not necessarily you hire the one with the prettier smile, but if one is smiling and one isn't, and they both have the same background, yeah, hire the one that looks happy or positive.
It just gives you that advantage.
Now, we were talking about it. In fact, I said, what do you want people to know on the show when you do this interview with me? And you said, I want to know, and I'm paraphrasing you slightly, but people that no matter how broken down their teeth are, that you could fix it. That's kind of a paraphrase. That's what you want. Is that right?
That is correct. I would encourage patients to come in. As some of the examples that we've shown on the show here, there is nothing that we can't fix now in dentistry. And this is also because of the amazing technology that it's available to us that allows us to do this. And like I mentioned earlier, it makes it such a joy because we really make an impact on people's lives, and we do this every day.
Now you said that people come into you one way, like maybe shy, or the guy looks like a tough guy, and then you give them their teeth and all of a sudden they're like a different personality, more charming, more outgoing.
This is correct.
Is that common?
It is. We see that, once again, we see that every day. You change people's lives, their quality of life, their confidence. I mean, these people are people with great personalities, and the first step they have to do is the fact that they're in our office. And we don't judge anyone. I mean, we're there to help. That's our job. That's what we're supposed to do.
So they're embarrassed, like when they have really, really bad teeth. Even in front of the dentist, they're embarrassed.
Even in front of the dentist, they're embarrassed extremely. And some of these people don't even want to open up. And we always encourage them that this is what we're here for. The important thing is that they've taken that first step in stepping into a dental office. Not necessarily mine, but
But it really can be done same day.
Yeah, absolutely. Because of because of the amazing technology and the training, we're able to provide a multitude of services, all very expeditiously on the same day.
All right.
It may take a couple of visits on certain cases, but most of our cases we are able to complete the dentistry that's required in one visit.
And you're big on sedation, so no matter how dental
phobic you are, how apprehensive you are, how much time you put off because of fear of the dentist, there's a solution with sedation. Like I said, we offer anywhere from oral sedation, nitrous oxide, which is a laughing gas, to IV sedation as well, which is, a lot of people opt for that. And you're able to get a lot of dentistry done in one visit.
And people like your office. I saw some of your videos on YouTube.
Yes.
They like that.
Yes, I mean, these are some of the people that are really, really excited and that are glad that they did the procedures that they went through. And often they say, I should have done this years ago.
So everybody should have a great smile.
Everybody is entitled to a great smile.
And eat whatever they want.
Whatever they want.
And no more loose-fitting dentures.
No more loose-fitting dentures, no more glue.
All right, I want to thank you for coming to the show. Great stuff.
Thank you, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.